All right. Welcome all to Raising Anchor 2026. I'm really excited about this session. My friend, mentor, supervisor, colleague for 15 years, and someone I've just learned an extraordinary amount from the great Dr. Bryan Zolnikov. But before we get into our session, let me talk a little bit about why we're even here. Hope Reform is a nonprofit agency registered as a charity in the state of Washington. It's also a 501c3. Hope Reform is a accreditation and certification organization that offers technical to agencies that are providing crisis services. Why is that important? Many small agencies do not have the resources to pursue expertise and technical assistance in reaching gold standards of excellence. Hope Reform exists in the gap for those agencies where getting to new levels of performance within the workforce, within the quality of services, and within the culture of leadership is something that is, generally speaking, only available to organizations that are well heeled to do that. The Board of Hope Reform consists of people who are global experts in their respective fields: workplace violence prevention, organizational leadership, psychology, psychiatric care and services, psychiatric nursing, and a number of other sectors. The organization makes that expertise available to agencies through the power of donations and expressions of support that you can exercise following consumption of this video. In the comments in our YouTube video, you'll see links that enable you to do that. And this year at our conference, we're not putting these presentations behind a paywall. We're separating the meaningful content from the opportunity to donate because we just think the message needs to get out there. So we've had a number of sessions this month. This one is particularly special because Dr. Zolnikov provides a foundation in principled leadership and a very effective mode of psychology and psychiatric treatment, of which his pedigree comes from the founder of the approach, the great Dr. Gordon Paul. And it was through Bryan that my professional experience in the psychiatric emergency response team was born and supported and clinically led by him. And there isn't an occasion where I haven't seen his generous nature and expertise not benefit people instantly with interactions with him. He's done this in the clinical setting programmatically. He's done it in a leadership capacity with people as subordinates. And I'm so very proud to serve with him on the board of Hope Reform. Welcome, Dr. Bryan Zolnikov. And I will call you Bryan, but it's important to mention that you are a psychologist. It's great to have you here.
Thank you, Andy. It's great to be here. I'm always, happy to support Hope Reform and anything we can do to help agencies and organizations to improve their, psychiatric care, especially with crisis responding. That is a, super delicate, moments that need to be, dealt with effectively to get, good outcomes and really avoid those really bad ones. But anyway, yeah, thanks for having me. Super appreciate being here. Thanks everyone for
Great.
joining too.
Yeah, certainly. Bryan, you come from a history of psychiatric care and services in a number of places where, by your own admission, you've had the good fortune to work with some legendary names in social learning, particularly Anthony Mendino, Bill Anthony, Will Newbill. These are people that you have engaged in, let's say, reciprocal kind of learning with. There's been shared experience, shared learning. Maybe you can talk a little bit about those early years and what values uh, became very clear to you as things that are immutable or timeless in the care and services sector. What were the things that really came through as things that must never be diluted or deviated from when it comes to human services?
Thanks, Andy. I'd say my first experience with a really good principled leader was in graduate school, and my advisor was Will Spalding, and
Yeah.
he, is a super expert in psychosocial rehabilitation. He essentially had programs running at the local state hospital. He had a pipeline of graduate students, working there as externs, and then and then he had an academic affiliation, of course. And so, my early experiences there put me into those inpatient centers where we're, facing the most severely mentally ill people on the planet,
Yeah.
and having to, and realizing, this is a difficult task. It is, it's not easy to help rehabilitate people to the point where they can, be discharged in a community and expected to be able to live there without a considerable amount of support from, mental health and other supports. And so that was probably my first experience that really shaped, kind of my entire path moving forward. Will really taught the sort of principles of, like, rehabilitation. People can be rehabilitated. I mean, that was kind of the first big thing is, there's all this talk, from decades of psychiatric care where they just, you give medication and that's the only thing that's effective, and
Right.
it was that way for how long, and medications, they have these nasty side effects. They don't, yeah, they can help out with symptoms. They can help people feel a little bit better, other things, but it's pretty rare that you automatically see a medication just boom, all of a sudden a person now is fully skilled in life and able to do everything and is doing wonderfully well. I mean, that just doesn't happen, right?
Right.
Medication is helpful, it's necessary in many occasions, but like then there's the rehabilitation part where we need to get the person community living skills. We need to help, shape their behavior to not be so bizarre and to be, indistinguishable from a regular person in the community, and all this different stuff. And so I would say my eyes were open at that point to the fact that like social learning principles, in terms of the rehabilitation context, work phenomenally well. I mean, it's just
Right.
amazing. And I even told him, I'm kind of blown away by this. I really want to now kind of, go from more of a direct care perspective to, I really want to analyze this program, and kind of take a higher level kind of approach to looking at rehabilitation. And he said, "That's great. Let's do a program evaluation." He's like, "We normally don't sort of do that kind of level of analysis here. We publish these academic papers and of our studies and put them in journals and all this stuff." He said, "But we rarely do something like that." So I said, "Yeah, no, I'd like to just kind of do a sort of high level program evaluation of this social learning program that you're doing." And yeah, quickly realized after tabulating the outcomes how successful it was, and it was that sort of, number one, people can and do learn and recover. Number two, you have to use a very effective program that has an evidence base to it, where it's been demonstrated that this stuff works,
Yeah.
and then you have to have that strong clinical leadership, driving it. And it has to be very clinically driven. You can't have a business person or an attorney, or you have to have someone with the clinical
Yeah.
acumen, and to sort of lead this thing. And so I'd say those three things were kind of the major influence, that I really picked up on working with Will. And then, and of course, people in that community, it's a small community, there's not a whole lot of us working, in serious mental
Right.
illness. It is a small type community. So, after my internship, Will was like, "Hey, check out what Tony's doing down at Fulton State Hospital in Missouri." So I give Tony a call, and Tony's like, "Yeah, we have postdoctoral training here. We have leadership, positions that periodically go vacant, da da da." we'd be happy to have you down here, and right away I was like, oh yeah, I definitely want to go work with another principal leader like that. I mean, it's
Yeah.
it's invaluable experience. And plus, after having that experience with Will, I was like, I don't want to downgrade and do something, that isn't, kind of up to this level of, principal leadership
Right.
and kind of
Right.
that powerhouse of like not only leading a clinical program at a large state hospital, forensic psychiatric hospital, but also publishing papers and having a tight lineage to academia, where they're collecting data and they're learning as they go and they're continuously improving their programs. And so I saw that and thought, oh yeah, I'm jumping on that. And that's where, Tony basically, was like, I'll be here to mentor you, in terms of your
Yes.
leadership skills. And I was like, boom, that's, invaluable right there. And so Tony, again, had those same kind of principles of, people can and do recover, use good rehabilitation programs that are evidence based. And so Tony, had used what Gordon Paul did in the 70s, which was phenomenal outcomes from social learning programs he was running. So, Tony installs those in the, Forensic Psychiatric Center at Fulton State Hospital, analyzes the data and finds, wow, I've got really similar results to, Gordon. Gordon did a lot of stuff on the civil inpatient realm because they were trying to empty out the civil hospitals, and they only left
Right.
like the more treatment refractory impossible people.
Right.
And so Gordon had to do something for that, super acute and refractory population. And so Tony said, well, it's kind of seeing the same thing here at Fulton State Hospital. People are, maximum security. They're not moving down the security continuum. They're very hard to treat, blah, blah,
Right.
blah. Installs it there. And all of a sudden, boom, he's having the exact same outcomes. Discharge rates are flying out the roof. Rates of violence are going down and hitting the floor. Active treatment engagement is going way up. When you're having all those positive outcomes, then it's easy to kind of now attract, people who are interested in that principled, rehabilitation approach. And so naturally it was like a great opportunity. And the cherry on the cake was, Tony was like, we'll meet every week and we'll, I'll do some mentorship around your leadership skills. And then eventually, and that's where I met Will Newbill, and Will was just
Right.
phenomenal. He was in intermediate security there. And I get with him and, we're looking at the program. And again, this another sort of principle is like continuous improvement. Let's not get outdated here. Let's keep looking at new technology, and that's where I brought
Yes.
a couple of new things to him. I said, hey, there's this intervention called Michael's game. I think we need to give it a try, da da da. And so, he said, great, let's wrap that into our sort of research machine here, do a program evaluation on that,
Yeah. Yeah.
and
Data,
I got yeah, I became an adjunct professor for the University of Missouri Psychiatry Department, and I started, let me start analyzing some data here, and so we had this really rich environment of these principled leaders, again with that academic, affiliation, really doing research and staying ahead of the game, getting really good outcomes, with an emphasis on, mental health leadership skills. And that was just invaluable. I knew after that experience, it's like I can go anywhere now and and
Yeah.
be an effective leader, in whatever different context, because I'm coming out of this like they taught me very well, and I got to observe with my own eyes and see it, how these principles translate into, great outcomes. And of course, I don't know how you are, but I know most human beings, when they have great experiences and great outcomes, they want to keep doing that. It's rewarding.
Yeah.
um
Yes.
and
Job satisfaction, feeling
yeah,
good about work.
right.
Yeah.
Exactly. And I mean, you're speaking about, compassion fatigue and, burnt out workforces. I feel sorry for people that work in those poor outcome environments where there's lack of, good leadership. They're not really doing really effective evidence-based practices. there's no principles guiding them, da da da. I can see why there's a lot of burnout in those types of settings, and probably a lot of,
Bryan, you're the
churn.
you're the first person who has really brought out um, uh, a a kind of indisputable outcome here. When the workforce make the claims of compassion fatigue, moral injury, burnout, overall fatigue, uh, high uses of unscheduled leave, high uses of
Mhm.
overtime, you can anticipate that before you get there, you're going to arrive at a place that's having
Oh
a
yeah.
lot of outcome problems with whether those are clinical outcomes or treatment outcomes or rates of discharge, no matter the setting. There does seem to be a very strong correlation between the wellness of the workforce and the quality of the outcomes. And in your opening salvo was just so rich. I want to go back and just kind of underscore some ideas here. The first idea you brought forward was the idea of belief. We can move beyond not knowing what we don't know into the realm of possibility. We can step into, with the proper leadership and vision, we can step into a new space where people can become aware of things they didn't know. And your second idea, immediately following that, was the right people with the right vision and right expertise. We need to have the right people in these positions. To your point, you said it brilliantly, and this is where the argument could be made that in some cases where things have gone awry, um, psychiatric and psychological programs are ideally overseen for clinical fidelity with someone who has that expertise. It's not done by an attorney. It's
Right.
it's not done by it's not done by an administrator. It's done by
Right.
someone with the proper expertise. And I think you suggest something there that we're being very gentle about it in this conversation, but you and I have a long history together of being outspoken and pushing against, let's say, refractory system problems. And we absolutely have a problem, I think, in our human services workforces where people who might be entirely capable managers without the right expertise are often not the right people to lead those
Right.
initiatives. And I cannot imagine, um, let's say, you know, I think Denzel Washington said it best. Um, Martin Scorsese was the right director for Goodfellas. Um, Steven Spielberg was the right director for Schindler's List. Both of them could have directed the other's movie, but the movie was optimal because of their expertise in that particular area, whether it was culture or the historical dispensation, whatever it might be. Could a
Right.
nurse run a clinical program? Sure. But is that the optimal expertise for social learning? And I'm speaking in very detailed terms, but the idea you're pointing out here is that we need to be able to have the conversation about the right expertise, and the right expertise belongs in certain areas. And when it comes to this kind of stuff, you need the right expertise. And then your third idea, which is really where the rubber meets the road, we have to measure these things. You can't manage what
Yeah.
you don't measure. And you went through the exercise, and maybe you can talk about the value of that for people who are afraid of measurement or don't know where to start. Maybe you can talk about the power of data and program analysis a little bit.
Yeah, absolutely. I mean, like you said, well, and I say this too sometimes, it didn't happen unless I see numbers that, say it show that it happened, if
Right.
there's no numbers, it never happened, and so my orientation, yeah, is very, quantitative, and I, and numbers help you understand the health or dysfunction of your system,
Right.
so and I know we can easily have an example here of, that first report that I wanted on seclusion restraint. I show me what's going on with seclusion restraint in this facility, in this program. I want to see it. Boom. When they put it on my desk and I'm looking at it, I'm going, oh my gosh, this is like astronomically high numbers. At first I thought the graph was showing me monthly rates, 300 400 hours a month, and I was
Yeah.
like, that's super high. But then when I looked closely at the graph, I was like, wait a minute, this is weekly. We're
Yeah.
having this amount weekly. Right? So right off the bat, the numbers have to alert you to either the dysfunction or the health of your system, and so right off the bat, for that type of example, it showed me, wow, this is something is way off in this system. Like this place is in desperate need of some kind of, improvement project to turn this around, to get these numbers to where they look healthy. We've also, started facilities, doing forensic programs in smaller facilities. And, we have governing body meetings where we routinely check the data every month. We want to see all this data on med outcomes, active treatment engagement, seclusion and restraint usage, override medication usage, all this stuff. We want indicators that are key indicators in, showing us the health of this program, whether that's bad outcome indicators and or good outcome indicators,
Right.
and we
Right.
started those. What did we find for a solid year after we got the program running good was the positive indicators were out the roof. Active treatment engagement was really high. Getting people the forensic competency was really high. Seclusion restraint was, zero. Med errors was almost zero. Injuries almost zero. Staff turnaround almost zero. And so it's like that told us there's something healthy going on here. It's not necessarily that this program is perfect, but like in terms of overall health, they're doing good here,
Yeah.
and then also using the numbers to give feedback to the staff, after we review this data and the data is looking good. Hey, congratulations on another successful month. Everything is really looking good there, Mr. Administrator or Director of the facility. We're, very proud of what's going on here. Your numbers are looking great month to month, and just really happy that you all are doing a good job there. Please tell the staff thank you. And so you can use it to sort of reward people. You can also use it to set goals. If for some reason it's like, wow, this number is really high, you can set goals to say, why don't we do, every quarter try to reduce it by 10%, or by 1 year, let's have it down 90%, or let's try to raise this. And then you set up the improvement process that should get you there. You pick the
Right.
evidence, like so seclusion restraint, perfect example, way too high. Okay, let's look at the evidence. What out there in terms of evidence, is there that brings that number down? Well, you got social learning programs that can bring it down. You got psychiatric emergency response team programs can bring it down, and you look at whatever you got available that is evidence based, that has worked in these same populations, same forensic psychiatric populations. And at that point, you look at what you got. What do I have in terms of staffing? What do I have in terms of this? How is the organizational chart structured? Da da da. Well, we can't do social learning programs on every unit, and that's an issue. So why don't we do the psychiatric emergency response team? Because we can do that with what we're allocated with here,
Right.
and so
Right.
boom, you take the evidence-based practice and then you thoroughly implement it. Like you said, principles, you hire people that are ideologically aligned to rehabilitation, recovery, people that don't want to, put their hands on patients, and to restrain them. You want to hire those people, they're compassionate about psychiatric care. They really want to do a good job. You hire those people. They do pretty good in high stress scenarios, and yeah, you bring them in, you spin up the team, you put a great leader, in the room with them, to lead them, and then you provide administrative support for that program to flourish, and then boom, what happens within 1 week? The numbers are down 95%.
Right.
And you go from 300 to 500 hours of bad outcome data to less than 50. And it happens in 1 week.
Yeah.
And so it's like that's how it's done. Again, you got the principled leadership, you look at the evidence, you gather your metrics, you figure out the plan for how are we going to roll this out to now get those metrics going in the other direction. You do it with the most effective way that you can. Get the great leader locally, hire the great staff, bring them in, attract them, and then treat them good. Pay attention to them. Validate them. Don't let that burnout creep in. Make sure that they're getting adequate amount of time off. Make sure that they're not being double scheduled all the time. Make sure they're not pulling too many overtime hours. Make sure you're helping to support their wellness and whatnot, and then watch that program flourish. So yeah,
Bryan,
data
I have
is
to I have to tell you, I have to interject this. There is so much hope in your message, largely because of the very credible and very matter of fact way that you present it. In other words, you're 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 underscoring, my God, you just got to do these things and things get better. And there's so much resistance to excuse me.
yeah,
This happens every time we get together, but like the matter of factness that you're using to say, well, and then you share the data with people and you discuss the
yeah,
data. And if all of the data isn't celebratory, you talk about ways that we can improve the numbers. And that's all true. Like that's the thing. Like if people would just take it easy and just apply these principles
right,
without getting personally involved in and that's where it gets jammed in. Well, if we discuss this data, that's my area of responsibility, and now my
right,
dignity or my performance could be subject to ridicule, and I don't want to share
yeah,
the data. And we need an environment where people move past these, I'll describe them as personal hangups
mhm,
when it comes
yeah,
to doing things as a group to move a system forward. This is where, for what it's worth, um, this is where we have to engage to some degree in more team oriented
mm,
approaches. And people, I think their personal fears and personal vulnerabilities show up in leadership decision making. And I'm so grateful for you to have been, let's say, nurtured by people who understood this, because this is what comes out in you. Like I'm sure that that Tony Mendito, for example, was very free with the data. Like, here's the data,
oh yeah,
everybody. Greg
yeah,
Smith, our dear friend and fellow board member, put the data on the internet for
yeah,
God's sake. Every
yeah,
indicator, everybody gets to see it.
yeah,
Here
public
are the
facing.
outcomes. And it's amazing how if someone is courageous enough to do that, how quickly everything changes.
Oh yeah.
You
Yeah,
know?
absolutely. I mean, like you said, if you're in a culture where it's acceptable, you got the leaders all, let's share data, let's look at this, and like you said, Tony Mendito, that's exactly the kind of culture that was set up there. We actually had I don't know if it was monthly or quarterly meetings with quality assurance, but all of the leaders of all the facilities came together under one roof with quality, and quality then would go over the outcome indicators and all this. I mean, it was part of our job function as leaders to be tightly connected to quality assurance and data collection and outcomes. That was part of the job, and so I was kind of enculturated that way. I also tell people, it's what you need to do to be at the top of your game, like look at football players, the most elite athletes in the world doing amazing things. What are they doing on the sidelines when they got that tablet? They're analyzing their data. They're looking at what was the coverage scheme for, if I'm a receiver, I'm looking, what was the coverage scheme here? Where did I go here? How did I mess this up? How can I improve this? They're using data to improve their practice. This is how they become the greatest, athletes in the world. And so it's like we want to be that way. We want to be
Right.
very open and transparent with our performance. We want to be able to look at it and with the eye of improvement, and we want to be able to work together to sort of make those improvements. And so yeah, when you're in that context, it's normalized, and you feel good about it. It's everything is improving, but then you can get these contexts where, like you said, they are not only apathetic towards something like that, they are opposed to it, because
Right.
now it's going to make someone suggest that their leadership was not good. It's going to make someone feel like, I don't know, slighted or misplaced or dismissed or whatever. And that sort of fear dynamic that goes on with some of these executive
Yeah.
teams and other things could really get in the way of trying to like create this kind of culture. And I
It's
find when
poisonous.
you
It's poisonous
it's
to a culture.
awful. Oh,
Yeah.
it's awful. I mean, and you mentioned compassion fatigue and all this, burnout. Those are the types of settings where I see that all the time. I mean, I go into these settings where, continuous improvement, quality assurance, data collection, good leadership, all that is present, rehabilitation programs, all this. And there's very little burnout. I mean, the burnout is usually like someone who's taking too many shifts, and it's like, just take the 3-day weekend and rest, and then they come back and they're
Right.
perfectly fine. But you go into these sort of scenarios where it's all that fear-based stuff. Everyone's hung up on this. The disciplines are siloed. No one wants to work together. People are angry. People, they don't look at data. They don't want to look at data. They don't want to start any programs that change anything. But you look at those systems, and there's tons of burnout there. I mean, the
Yes.
staff are unhappy. The outcomes are pretty poor, and staff are burned out. And then they complain too, is, oh, we can't retain staff. It's like, well, yeah, of course you can't retain staff. Like, they don't want to work under this type of leadership,
Yeah.
and this type of system you set up, because you get bad outcomes, and there's no improvement orientation. There's nothing there that kind of provides them with this, hope for a better future. You've just sort
You,
of locked them
you-
into this dungeon now.
right.
And so
You,
yeah, that's why you have trouble retaining staff. Oh, well, we're going to ask the legislators to increase the salary so we can retain staff. And it's like, no, well, you did that, and guess what, you still
yeah,
didn't retain
Brian,
them
we
because of
now
your
know that's
leadership.
not working. It's not working.
Yeah,
We're
yeah,
offering hiring incentives in juvenile
yeah,
justice throughout the United States. Come work for us, get a
yeah,
$15,000 bonus, get a $20,000 bonus. We can't get people in the door because they
right,
know that
yes,
what the workforce is facing in there is extraordinarily demanding, and they hear the
right,
stories of the people that work in that place. It's not money.
right,
It's got,
yeah,
I think, our friend Dan would say mastery, autonomy, and purpose. And there's truth to that.
yes,
And,
yeah,
what you are bringing forward is what our fellow board member, James Sporletter, would refer to as psychological safety. There is no psychological
mhm,
safety when we can't talk about data. There's no
right,
psychological safety when people are afraid to make recommendations for improvement because they feel as
right,
though that their idea is not going to be valued or weighted properly in whatever
right,
environment it's proffered. And I when I think about this, I think about how in other sectors we don't have this problem. In industrial safety, nobody will object to the use of data to inform practice
Right.
to improve safety measures. And we're constantly showing it. How many days at work without an accident? Air
Right.
quality is improved because of these silica filters. Like nobody objects to freely sharing the data there. And in our environments in human services, we even I remember I did a training. I won't name the company, but it's a very household name company that has a headquarters in Seattle. And I'll never forget when I walked in the door. The first thing you see is this giant amphitheater where staff can hang out and work or not work. Completely egalitarian workspaces. You just took whatever space you wanted, no offices. Um, Wildly different environments that you could do this in. You could do it in what felt like a cafe style area or a garden style area. People were allowed to bring their pets to work. The studio division of their company had their productions playing on a giant screen. There was a full contract eatery, every kind of food you could possibly want. Like they're
Right.
investing in the wellness of the
Yeah.
workforce because they have figured out that productivity improves.
Yeah. Yeah. Yeah.
Like
And there's
I'm
research and data on that. Yeah, I mean, I've even, in the design of the new psychiatric hospital that we're building here in Washington State, we looked at all that stuff. I mean, there's like napping pods, where you can get a 5 minute power or 7 minute power nap, and yeah, they're starting to include those things in the workforce because really you got to take care of that workforce, like they are the key to everything you're doing. If you don't take care of them, you're toast. You're going to have the bad outcomes. You're going to have the tons of turnaround in terms of staffing, all this kind of stuff. And so yeah, they now and I'm glad to see this starting to happen here, where they're at least coming to some of these ideas that, well, we got to kind of make our workforce happy and kind of focus on like wellness and other things.
right.
It's like yes, absolutely, the people are what drives this whole thing. The people.
Bryan, when many of our viewers are looking for answers, they're looking for hope, they're looking for ideas. So, to our viewers that are watching this discussion between us, and they're in a place where these challenges that we've been highlighting exist, what are some ideas that you can give them that, let's say, inspire them to action? Uh, what would you say to a mid or senior level manager or administrator of a system, whether it's behavioral health or juvenile justice or adult corrections, and they're aware, they're aware of the complexity of the problem and they don't know where to start? What would you say to that person right now?
Yeah, I mean that's a tough one. Obviously, heavily contextually, kind of driven there in terms of what I would recommend. I mean, I'm big on like what I call like learning about things and then planting seeds. So go and learn what is principled leadership. Go pick up the book on that. What is psychosocial rehabilitation? Go pick up the book on that. Go learn about all of these different things, get a good sense for what it is, start envisioning how that could be implemented within whatever system or program or facility you're running. Get some ideas there, start planting seeds, with the people above you, the people below you, and see if those seeds start growing somewhere. And then of course just cultivate as needed. I mean, that's for kind of middle management level, that's probably the least offensive way to sort of
Yeah.
go about something.
Yes. So
learn about
planting,
it,
that's
envision
a
how
great
it,
recommendation.
yeah,
A great recommendation. Planting seeds, accepting that this is going to take time, accepting
yeah,
that not everybody um, may want to cultivate those seeds, and
right,
having to and being okay with that, but planting seeds, to always be involved in, um, let's say, to, let me rephrase that, to let go, and I will share this. One of the things I had to come to accept, because
mhm,
as I mentioned earlier, your credibility and matter of fact nature, just do these things and things get better. That's true when in cultures that are unwilling to just commit fully to some of these ideas. The cost of that is that we have to live with witnessing unnecessary suffering in the lives of people as we're trying to move the ball downfield. So it will never be struggle free. Even
oh yeah,
planting the seeds will never be struggle free. Somewhere we have to, and this is not the employer's problem, somewhere we have to accept the existential reality that there is no improvement without struggle. And even in the planting of the seeds, there's going to be ongoing struggle. And to attend to your own well being along that way, use the napping pod while you're planting
yeah,
seeds, use the wellness room while you're planting seeds. Think the long game, because
right,
um, the idea that you're going to get everybody to just be elucidated with this new idea and 100% be bought in. I suffered a lot because I thought that's what would happen. I thought
yeah,
everybody would think, wow, this is like the fax machine. Let's never write a letter again. And we'll all
right,
use the fax machine. And that's not what happened with the fax machine. And then the fax machine would break and too many people would try to use it at the same time or whatever. Like there is no such thing as the struggle has now vanished.
right. Yeah, in the marketplace of ideas, it may be a very high value, item, but perception of value is going to vary considerably. So yeah, be ready. It's not, resistance will happen, and at some point, ask yourself, okay, what is strategy am I doing? Do I need to slow it down? Do I need to switch it up? Obviously there, take a thermometer out and figure out what's going on here in the system I'm working in. Also, the idea of, do you have locus of control for any of this stuff? I
Oh,
mean,
talk more about that, please. That's so
yeah, I mean,
important.
yeah, I mean, it's like are you an influencer or are you an actual supervisor? Are people in your chain of command who can enact your vision, or do you have no one in your chain of command, but you have a vision, right? I mean, so you got to like be very aware that even if there's an idea and you're passionate about it and you're planting seeds and you're trying to move it forward, the very idea that, it can take off or it can crash is really not your control. Like you cannot direct staff, if you're not supervising staff, you cannot direct them to sort of do this, you're not in the big chair, right? So, you have to be mindful of that too, that, be mindful of your locus of control, and be accepting of, what are your limits here? Like when I did a clinical leadership deal one time, I had zero supervision over any staff, and they were asked me to lead them, and so I used what I called raw leadership skills, where I provided motivational statements. I used the big here. I validated.
Yes.
Suggest alternative. I mean, I literally worked very hard at making sure that everything I did intentionally, was perceived as high value leadership stuff, because I knew like I have zero locus of control here. These people can literally tell me no, and there's nothing I can do, right? So I had to go in and just really do as much leadership as I can, and just, at the end of the day, accept that I have no locus of control and they can take it or leave it. Luckily in this circumstance, they took it, and they were skeptical with me though about this. We don't know if it's going to work. Da da da. Okay, that's healthy. Thank you. I mean, I'm skeptical too. We're all in the same boat. Validating, kind of
Right,
aligning all this
right.
stuff, right? Sharing frustrations, sharing possible outcomes, doing all that leadership stuff, right? And so, boom, 3 4 months later, staff are like, "This is working. Our results have gone down. The patients are actually going to treatment groups, and da da da." And then all of a sudden, boom, the buy-in was automatic at that point. Now it
Yeah.
was like, okay, now I can sort of cool off with my raw leadership stuff and let the outcomes themselves start to sort of drive people's motivation to, really sort of perform, this program and everything. And anyway, so that kind of brings that to my mind is like, yeah, driving stuff and planting seeds, but also just be aware too when you may need to switch up your strategy, and also
Oh,
be mindful
yes.
of your locus of control.
Oh, I'm so grateful that you brought that up, because the 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 continuum that you kind of outlined was, I'm going to exercise whatever social capital I have in the advancement of an idea. I'm going to try to engender support. And then I know that if this thing begins to get built, this thing will sell itself, like Honda.
Right.
I mean, remember for
Yeah.
years, the Honda salesperson doesn't have to work that hard because the Honda sells itself. So I remember those ads as a kid. So,
Oh yeah.
I think of our friend Gary Nesner, who was the founder of the FBI's crisis negotiation unit. So often he would try to get the negotiators who would take the outcomes of their effort very seriously if there were a tragic outcome on a
Mm.
negotiation, or if there was let's say, a lethal use of force. The negotiators would take that very personally, and Gary would have to get in there right away and say, that was outside of your locus of control. You did what you were supposed to do. And um, uh, the fact that this didn't go the way that we all wanted it to does not ultimately rest with you, and
Right.
somehow you can detach. It's almost like that old 12-step program adage: take the action, but release the results. Something like that. Let go
Right.
of the results. Like, you take the next good action, which is planting a
Right.
seed, or, hey, can I offer you a suggestion about that interaction you just had with so and so? You looked very frustrated when it got done. And if the guy says, no, I'm really not interested in what you have to say, okay, and then try to let that go. People
Right.
can become very, and I know I was, and it brought me a lot of suffering. I was
Mhm.
very attached to the outcome, and I took that um, very personally. Now, whatever toll I paid in suffering, I don't know if I would do it different retrospectively, but I just know that I I ushered in a lot of suffering because I attached personal ownership to
Mm.
things that I had no control over, none.
Right.
And your wisdom here is profound on that topic. Um, Bryan, as I think about the future, we have younger people coming into the care and services setting. We have AI really beginning to get involved in the day to day life of how people engage documentation, how they engage record keeping, and the attention economy, um, in terms of what people consume personally. What do you see on the horizon as, let's say, needed interventions in to get, what preparations do we need to make for new problems that may be coming on the horizon for workforces that are having resilience challenges? Any thoughts on that?
I mean, with AI, all that stuff, that's just getting into a level where that's, ask Luxtonian about that. I'm sure you get
Yeah,
some
yeah,
good.
yeah. We should have him on the next virtual Raising
Yeah,
Anchor conference. Our AI friend, Dr. David Luxton.
yeah,
Um,
yeah. Be great to
I
have.
guess the reason I bring it up, Brian, is that we're using a lot of AI in
Yeah.
healthcare and behavioral health now. And from your vantage point in system leadership, is that impacting anything with inpatient care that you see?
Yeah, I mean, it's starting to, and I think, again, to be just to kind of answer your question in a little bit, or provide some sort of direction for the future. The first thing I would say is, raise your leaders to be principled leaders, provide good mentorship, be a good leader yourself, self study. I don't know, whatever, get the book on principled leadership. You know what I mean? Like, really work on yourself, work on, mentoring and helping to develop people become leaders. I mean, that I think is, very necessary, especially in mental health programming, because a lot of clinician-based people don't get leadership training in their graduate schools. It's not a standard part of it. You're getting trained on technical ways of providing assessments and treatment recommend. Blah blah blah. You're not getting leadership. So I would emphasize for people in psychiatric care settings, or even just other care settings, to really pay attention and foster and mentor good leaders. That's a huge thing. Okay. Um, in terms of like AI and its interface, like, yes, that's coming, so I would become very familiar with it. I would also understand your organization's policy around it. I would also, if you have a role in shaping that policy, be very careful with, what you're doing here. Consult with some of the experts. We mentioned Dave Lux, consult with Dave, make sure that you're using it in the appropriate sort of application and your guardrails are around it, et cetera. So be very careful with that. I mean, I would say that is probably, yes, a new innovation that is going to, start coming in fairly heavily here. So we need to be ready for it, self-study, consultation, I don't know, whatever you need to do to become very familiar with it is absolutely necessary. You know.
Well, it's the first principle you brought up in this discussion, Brian. Go and learn. If you're
Yeah.
feeling
Yeah.
overwhelmed, go and learn. Pick the books up, take the
Right.
course, do the virtual class, take the asynchronous class, lean
Right.
into learning about it so that you can reconcile what you want to do. Do you want to be part of it or not? Do you want to plant
Right.
seeds or not? Do you want to lead? And and I think the final real gem that you're bringing forward here is uh, everybody can benefit from leadership development. Everybody can
Oh,
benefit from leadership
yeah.
development, and that leaders need investment in themselves, and agencies need to invest in their leaders. And if you're having leadership challenges, lean into leadership development. Take the
Yeah.
courses, get the experts. They're going to tell you the same thing. They're going to tell you share the data openly. They're going to
Right.
tell you get the right people in the right positions.
Right.
Let them know that what if you don't know what you don't know, there's possibility. You can move
Right.
beyond that, and people
Right.
have. So, once again, Brian, there's never an interaction with you that isn't just chock full of very rich, timeless ideas. That I mean, you made the analogy to football, for God's sake, that the highest level of at the highest level of athletic performance, these are people who are not afraid of the data. They go
Right.
over to the tablet and say, I didn't run that play optimally. How could I have done it differently? There's an openness, there's a what James would say, there is a psychological safety net
Mhm.
there.
Yeah.
People are safe And if people aren't feeling safe, we have to fix that foundationally first, I think.
Oh yeah, yeah.
Yeah.
And that starts with leadership. I mean, the leaders have to be, create that context for that psychological safety. Using trauma-informed care principles with staff works really well. In terms of helping to establish safety with implementing processes like that. So yeah, absolutely, and do a lot of self-study. There's lots of material out there that's really good. And develop your leaders, optimally, get educated about that, become a good leader yourself. You know what I mean? Like those are all things that leadership can happen at every level too. I mean, you could tell me, well, I don't supervise anyone. I don't need to be a leader. Well, you collaborate with people, you email people, you do other things. You're in meetings with people. Like you could exhibit some leadership skills, so it can happen at every single level. Um, so I'd say that's a huge key component to having successful mental health programs. And I appreciate you too, Andy. I've learned a lot from you, and I super appreciate you, especially what you're doing here with Hope Reform, raising Anchor and Jumpstart Mastery too. So definitely love all of it and love to support
Thank you,
it. So
Bryan. You've been such an inspiration. Bryan, final thought: where can people learn more about the category of continuous improvement and all of the, let's say, the curriculum or content or ideas about that? Where can people learn more about continuous improvement?
I mean, I would look at some of the older literature, like Deming's literature. Take a quick peek at that. There's some gems in there that are to this day, still utilized and thought of as best practices. Certainly, then from there, take a look at how continuous improvement has been implemented in mental health systems. So when you do an internet search or whatever kind of search you're doing with library search, whatever it may be, go ahead and put in continuous improvement and then put in mental health programs, and
Yeah.
see what you come up with there, because there are a few authors that do have some specificity to mental health programs that publish some really good stuff. It's out there.
Okay. Bryan, thank you so much for just your presence and your consciousness and your warm and generous spirit. I'm always enriched by our time together.
You too. Hey, always good talking. Always good seeing you.
Okay, brother. We'll talk soon. Take
All
good
right.
care.
Okay. Take care. We'll see you.